My name's Ian Adatia, and I'm Professor of Pediatrics at the University of Alberta, and I'm Director of the Pediatric Pulmonary Hypertension Service at the Stollery Children's Hospital in Edmonton, Alberta. And we also provide a service to most of Western Canada. My interest in pulmonary hypertension began at Great Ormond Street in London, England, with Glenys Howarth. And then I was lucky enough to work with David Wessel in Boston Children's Hospital. And then I established a pulmonary hypertension clinic and service at Toronto Sick Children's Hospital, where I was for 10 years. And then I moved to San Francisco and spent 5 great years there with Jeff Feynman, and then moved to Edmonton in 2008. Through the Pediatric Pulmonary Hypertension Network, we're able to make sure that through that resource that even children who are far away from a big centre can get the best care, and that their case can be discussed with colleagues, and so that we can make sure that even if you live in a small town somewhere in Western Canada, that you can leverage through your pulmonary hypertension clinic resources that are available to children living in big centres or big cities. The key to going forward is a partnership with the families and the children to figure out the treatments that are available through networking and finding out which is the most appropriate for them. So the Pediatric Guidelines was an initiative through, I think, Steve Abman and Stephen Archer. And we've been aware for a long time that there were guidelines for treating adults with pulmonary hypertension, but there was a gap in providing those, providing recommendations for neonates, infants and children and adolescents with pulmonary hypertension, and becomes especially important now that outcomes are improving and more children are being discharged to adult clinics, that there needs to be some sort of background about how to care for them, and that especially for people who don't see pulmonary hypertension on a regular basis, and even for those who do, some documentation of the way that we manage them now, so that we can really direct our attention to areas where we know the least to provide the research for the future and hopefully the future treatments. Hopefully it'll fulfill a niche for the person who occasionally sees a child with pulmonary hypertension and will know who to contact, the fundamental things to look for, and also for doctors who are quite experienced with the care of children with pulmonary hypertension, for them to understand the areas where we work with good evidence, medium level evidence, and areas where we need a lot more information. It was a really collaborative effort, and really Steve Archer and Steve Abman probably had to work very hard to keep all these people focused and bring them together, but they did a great job. So I think almost everyone contributed to a number of areas, and the areas that I was particularly interested in was the classification of pediatric pulmonary hypertension and pulmonary vascular disease, the intensive care unit management, the association with congenital heart disease, and the way that we investigate them with cardiac catheterization, and some aspects of neonatal management of pulmonary hypertension, especially diaphragmatic hernia. But it was an effort of collaboration, but those were the areas that I was most interested in. We wanted to be sure that children who have a problem with their heart that may lead to pulmonary hypertension were investigated appropriately, and so that if they needed to have surgery, that decision was made appropriately and with the right investigations and safely for the child. We wanted to be sure that children having a cardiac catheter test, that was done in a logical sequence and the safest possible way. And we wanted to be sure that any children with pulmonary hypertension who were unfortunate enough to have to be on an intensive care unit, that we educated intensive care doctors about some of the difficulties and nuances, or some of the important aspects of looking after children with pulmonary hypertension that may be different from children with other reasons to be on the ICU or the intensive care unit. The idea of making the guidelines understandable to families and children is a great perception, And I think we probably should have written the guidelines with a couple of paragraphs for families and patients, and maybe we should do that in the future, that guidelines for rare diseases should include a patient-oriented section that is a digest and easily understood by non-medical practitioners. Having said that, I find with the internet, my patients and families are a huge resource and so knowledgeable about pulmonary vascular disease, and I think that's a wonderful thing about the age that we live in, where knowledge is everybody's. We would like the children to live as normal a life as possible and look as normal as possible, and that, you know, when you see an active child but they've got oxygen on, you can see they're different, and so we need therapies that allow them to go to school and not appear different as well. And that's something that I didn't really think about. When I only see them in the clinic, you just accept that patients are in the hospital, so they carry things around them, that there's the stigma of their disease and of being treated in a patient, but that most of their life is spent out of the hospital, and you realize that we really want to be able to treat them so they don't have to carry these stigma, if you like, of their disease around with them.